Hey, my name is Madison and I'm going to be showing you how to insert an IV. First, I'm going to knock on my patient's door, verify my patient and identify the physician's orders. I'm going to wash my hands and apply clean gloves. Next, I'm going to assess my patient's veins and I'm going to assess from distal to proximal, assessing for buoyancy of veins and ones that don't bifurcate. So I'm going to use this vein right here. After I've found my vein, I'm going to apply the tourniquet 4 to 6 inches above the site. After I've found my vein, I'm going to take my ChlorPrep and scrub the site for 30 seconds from clean to dirty. And then I'm going to allow that to dry. I'm going to get all of my equipment set up. So I'm going to get my piggy toe and my 3 ml syringe. I'm going to scrub the hub and attach my syringe since I'm taking blood from the patient. I'm going to put that in the clean container. Next, I'm going to take my needle, bevel up, and insert at a 45-degree angle. I'm going to hold the skin taut. And then I'm going to advance the catheter. And I've seen flashback. And then I would advance the catheter, pop the tourniquet. I would occlude the vein. I would place that in the sharps container. And my hub has been cleaned with ChlorPrep. And I would attach and hold this up here for stability. And then since I'm taking blood, I would draw back my blood. Okay, I've got that. I would set that to the side. Then I would scrub the hub again and attach my 10 ml syringe. I'll first get out the air, attach my 10 ml syringe, and then I would flush, getting all the blood out. Would throw that away. And then I'm going to take my bandage and apply that. And then also saline lock the tubing, apply tape. And then at this point, I would also assess a patient's reaction. I would assess for any infiltrations, swelling, redness, streaking, and I would also, like I said, tape this down as well. So once I've done that, I would take my needle and I've got my blood. And then I would verify the physician order of the blood order, and then I would pop the cap. And then this is a vacuum container, so all the blood would go in. And then after the blood is in, I would throw that away in the sharps container. And then I would send this to the lab. I would print out off the label with the patient's information, send that to the lab. And then at this time, I would also write on my IV the gauge, date, time, my name, and I would take off my gloves and document the patient's reaction, wash my hands, and I would also state the IV safe med administration. So I would verify IV compatibility with piggyback substances. I would not infuse blood products, or parenteral nutrition through the IV, and I would also not infuse potassium chloride as an IV bolus. And I would also verify large So some principles of safe med IV infusion are: you would never administer potassium chloride through an IV bolus, and you would also never administer IV medication through the IV that's also infusing blood products, or parenteral nutrition. And you would also need to verify the compatibility of IV piggyback medications. And you would also you would use an infusion pump to infuse IV medications that can cause serious adverse side effects.